Hi everyone, I'm Dr. Soumya Dwivedi from Qura Diagnostics and Research Center, and today we are meeting yet again in this wonderful webinar with our expert Dr. Anushi Pandey, and we are going to talk about knowing more about infertility and bursting the myths about it. So welcome Dr. Anushi Pandey. Let me tell you something about her first before we start. So having done MBBS from Bharati Vidyapeeth Pune, MS Obstetric and Gynecology from Era Medical College, Lucknow. She did her senior residency from Lal Bahadur Shastri Hospital, Delhi. Her keen interest in infertility led to acquire fellowship in assisted reproduction and laparoscopy. She had the privilege to work under Professor Arnold Watnes, who is the president ESGE IR CAD France, and also acquire FMAS from World Laparoscopy Center. She has also worked with very renowned laparoscopic surgeon, Dr. Deepak Limbachia. I hope I'm pronouncing everything right. And presently, she holds the post of Secretary, Saharanpur Obstetric Gynecological Society. She has many awards, including a special one. She has won the Young Turk Award Foxy 2019. And we are privileged and honored to have you amongst us as an expert panel, Dr. Anushi. Welcome.
Thank you so much, Soumya, for such a wonderful introduction. I'm feeling so nice, and I also want to introduce about you. So I'm so glad that, we are able to talk on a really good topic. A lot of questions are there in people's mind about infertility, and they really want to know the basic concepts about various issues. I would first like to introduce about you. So Soumya Dwivedi is a MD radiologist and director of Qura Diagnostic and Research Center, Bhopal. She has received fellowship in pregnancy imaging at the esteemed Mediscans, Chennai, and certified by Fetal Medicine Foundation, UK. Qura Diagnostics has received Best Diagnostics and Imaging Center in MP. She has received many gold medals and many reputed national and state conferences. She is also ISUOG certified for advanced OBS ultrasound, as well as UK certified for NT-NB scans and pre-eclampsia screening and fetal abnormalities. I welcome you, Soumya. I think we should start.
Yes, thank you so much, Anushi. That was a very elaborate brief, but thank you so much. And without wasting any further time, I know that many of you have a lot of queries regarding infertility, and that's why today is World Health Day. And I wanted that we could get an expert panel to talk about this. So my first question, without any further ado, Anushi, what is infertility? Let's start with really basic.
Exactly. So infertility is actually failure to conceive or achieve a clinical pregnancy after 12 months or more of regular unprotected intercourse.
Okay.
So that is called infertility. Like, you have tried for 12 months and still you are not able to conceive, then you have to consult the doctor.
Okay. So, Anushi, is this the same for everyone? Like everyone goes through the same cycle of infertility? Is it same for everyone?
For most of them it is the same. सबके लिए generally same रहता है कि अगर आप 1 साल से ट्राई कर रहे हैं तब भी आपको नहीं बेबी हो रहा है तो आप एक इनफर्टिलिटी स्पेशलिस्ट को दिखाएंगे. लेकिन ऐसे बहुत सी महिलाएं हैं who are more than 35 years of age, जिनका ओवेरियन रिजर्व धीरे धीरे एज के साथ डिक्रीज हो जाता है, तो उनके लिए क्राइटेरिया ये है कि अगर वो 6 months तक रेगुलरली ट्राई कर रही हैं तो उसके बाद भी अगर उन्हें बेबी नहीं हो रहा है तो उन्हें कंसल्ट करना चाहिए एक फर्टिलिटी स्पेशलिस्ट से.
Right. So 1 year is the window period we should remember. So
Yes.
if a couple is trying for 1 year, everyone, 1 year is your period to remember, and 35 up, the rules change. All right.
Exactly. There is also one more point I wanted to tell, that
please.
There are many women who already have a lot of infertility features, like periods नहीं ठीक हो रहे हैं, चढ़ के आ रहे हैं, या husband के अंदर problem पहले से ही पता है, तो उन्हें as soon as they know, they should consult the doctor. They shouldn't delay that.
Right, because the further you delay, the more problems can be, caught up. So, all right. So, tell me one more thing. Everyone asks this question. Okay, when should we try? What are these fertile days? So, can you just tell something about that, please?
बिल्कुल. The first question should be about timed intercourse. लोगों को पता ही नहीं होता है कि what is the exact time that they should start trying. They try haywire, कभी इधर. So they should actually know कि एक नॉर्मल मेंस्ट्रुअल साइकिल 21 से 35 डेज का होता है. अब हमारा ओव्यूलेशन नेक्स्ट पीरियड जब भी हम अज्यूम कर रहे हैं उसके 14 डेज पहले हम एक्सपेक्ट करते हैं. फॉर एग्जाम्पल अगर आपकी साइकिल 28 डेज की है तो उससे 14 डेज पहले आपका 14th डे पड़ता है. सो दैट इज द मेन डे दैट वी इमेजिन कि ओव्यूलेशन हो रहा होगा.
That is like the
ओवम
peak
का लाइफ
fertile day. Peak
एग्जैक्टली द
fertile
मोस्ट
day.
फर्टाइल डे. एंड
Okay.
ओवम 24 आवर्स तक लाइव रहता है. तो उसके 2
Right.
डेज पहले एंड 2 डेज बाद को हम
Mhm.
कहते हैं द फर्टाइल डे. दैट इज 12th
Right.
to 16th डे. कुछ लोगों के साइकिल्स लंबे भी हो सकते हैं, जैसे अगर मैंने बोला 35 डेज हैं तो
Right.
उससे 14th डे पहले मतलब 21 डे विल बी देयर मेन ओव्यूलेशन डे. तो
Okay.
उसके
Okay.
2 दिन पहले एंड 2 दिन बाद विच इज लाइक 19th 20 21 22 23.
Also,
they
one
are
more
the
question I want to add to this, Dr. Anushri. Many patients I've seen that, they don't know what is the first day of your period. They are very confused. Is it the day when your periods have ended? That is your first day. Or is it the day where your periods have started? So I want you to tell me
very
that.
very good question. Most of the question, whenever I ask a question to anybody, they always say इस दिन हम नहाए थे का मतलब है the period ended.
Yeah.
Rather I want to know when the period started. So the first day is the day when you start bleeding. That is the first day of the last period. That is the main day from where we start calculating.
So to calculate the 12th to 16-day window period, we should know the first day is the first day of your menses.
The next menses, exactly. For example, you assume कि next menses मुझे 28th को आने वाला है, तो उसके just 40 days पहले assume करेंगे कि ये हमारा ovulation day होगा.
Correct. I think I've answered so many queries right now. Thank you, Dr. Anushri. So also in continuation to this question, I think please you should tell us that what is the workup you really think is required for an infertile couple. All right. So a couple has been trying for a year and still not successful in getting pregnant. So what is the workup you suggest as a gynecologist or an infertility expert that they should go ahead with?
I would like to tell that, infertility is affecting almost 1 in 7 couples. There is a lot of anxiety and stress among couples when they visit you.
Right.
They have to be told that both male and female are contributing to infertility. So it is not only the female. सिर्फ एक औरत की जांच करानी जरूरी नहीं है, एक आदमी की जांच होनी भी बहुत जरूरी है. दोनों ही इक्वल कंट्रीब्यूशन करते हैं. अगर 30% फीमेल कर रही है तो 30% मेल कर रहे हैं. 20% वो दोनों मिलके कर रहे हैं कंट्रीब्यूट. दोनों के ही प्रॉब्लम्स हैं और 20% अनएक्सप्लेन्ड है. तो जब हम इनफर्टिलिटी की जांचों को शुरू करते हैं तो सबसे पहले इन्वेस्टिगेशन होनी चाहिए सीमेन एनालिसिस, हस्बैंड की शुक्राणुओं की जांच. दूसरा, फीमेल के अंदर क्या क्या जांचें. तो 3 इंपॉर्टेंट चीजें होती हैं. एक, तो उसकी अंडेदानियों में अंडे बन रहे हैं कि नहीं, जिसे हम कहते हैं कि ओव्यूलेटिंग और नॉट. सेकेंड, ट्यूब्स ओपन है कि नहीं. राइट. तो ये सबसे इम्पोर्टेंट हो गई. अब इसी के लिए मैं चाहूंगी सौम्या दैट यू आर माई पार्टनर एंड यू हैव टू टेल मी how does imaging help in actually supporting the infertility diagnosis? Can you please
So in imaging, there are multiple modalities which really come to picture, when we have to diagnose an infertile couple, right? From pathology to radiology, right? So pathology, as you suggested, that semen analysis is one. AMH, I feel that one investigation very important.
These are the hormonal parameters.
Right. So now coming to the radiological aspect, one is, when the patient has been trying for some time, तो हिस्टोसैल्पिंगोग्राफी एक जांच होती है जिसमें हम ट्यूब्स ओपन है कि क्लोज, दैट इज पेटेंसी ऑफ द ट्यूब्स को असेस करते हैं. ऑल्सो उसके साथ उसके अलावा कोई एडनिक्सा में मासेस वगैरह होते हैं या कोई लीजन्स होते हैं जो ट्यूब को दे आर कंप्रेसिंग द ट्यूब्स, दे आर ब्लॉकिंग द ट्यूब्स, उसको उस चार्ट से भी पता लगाया जा सकता है. ऑल्सो वन वेरी वेरी यूजफुल मोडालिटी इज ट्रांसवेजाइनल इमेजिंग ऑफ द यूट्रस एंड द एंडोमेट्रियम एंड द ओवरीज, सो दैट यू रूल आउट कि कोई ऐसा स्ट्रक्चर या ऐसा कोई मास तो नहीं है जो अंदर की लाइनिंग पे दबाव डाल रहा है या इम्प्लांटेशन होने में प्रॉब्लम कर रहा है या ओवरी के अंदर ही इन इटसेल्फ कोई सिस्ट या मास ऐसा है जो पेशेंट को फर्टाइल होने नहीं दे रहा है. सो बेसलाइन इन्वेस्टिगेशन एट डे 2 is really suggested for when you start planning or when you are in unsuccessful in conceiving. So sonography, that too transvaginal, I will insist, transvaginal scans is very very important to see your endometrial lining, ovaries and the surrounding structures, that is the adnexa. Third investigation, which really does come into picture, is a follicular study or an ovulation study, which is very crucial and important for a female who is going through this process. So in that, जैसे डॉक्टर अनुश्री ने हमको बताया कि अंडे कितने बन रहे हैं, what is the quality of the eggs which is forming, is it actually rupturing or is it actually giving you a good egg, that is there formation of a dominant follicle. आप लोग ने गूगल किया होगा बहुत सारे लोगों ने, और आप लोग ये हमेशा डॉक्टर्स के पास आके पूछते हैं, डॉक्टर मेरे पास डोमिनेंट फॉलिकल है कि नहीं. सो ये ओवुलेशन स्टडी आपको बताती है. ऑल्सो a very important process in doing an ovulation study is repetitive analysis to see whether your endometrium is simultaneously growing with growing with the same proportion as your egg, so that both can have the right amount of thickness and a good quality of egg at the same time to give a good chance for a patient to conceive. So
I think your help is the most important help whenever I have to assess an infertile couple, because until I don't know, because this contributes the maximum. Ovulation सबसे important role play करता है. एक patient अगर ovulate कर रही है तो उसे conceive करने में कोई problem नहीं होगी. और एक right radiologist ही सही size of ovum को follicle को diagnose कर पाता है.
Right. And also, Anushri, I would like to add to this point, since we are live and people have been watching, there's so many reports which I see for ovulation study in which patients get this scanned and transabdominally. Okay. Yes. And it is not useful because there's so many informations which actually are missed transabdominally. And once you're married, you must get a transvaginal scan to see everything. Sometimes very tiny polyps at the fundal aspect of the endometrium, जहाँ implantation होता है, वो रह जाते हैं,
दिखता ही नहीं है.
Yes, so it's very crucial. That's why we're insisting again and again. Transvaginal is the scan of choice. You must do. अगर आपका डॉक्टर आपसे ऊपर पेट के ऊपर से ही जांच कर रहा है ओवुलेशन स्टडी की, so please don't get that done. Please insist कि आप एक high resolution transvaginal scan ही कराएं.
व्यूअर्स, आपको ये जानना बहुत जरूरी है कि फॉलिकुलर स्टडी ट्रांसवजाइनली ही करनी है. Yes. और बहुत तरीके से होनी चाहिए, तभी एक सही डायग्नोसिस बन पाती है कि आप ओव्यूलेट कर भी रहे हैं कि आप नहीं ओव्यूलेट कर रहे हैं. थैंक यू सौम्या, थैंक यू फॉर सच अ वंडरफुल आंसर. सो सौम्या, आई आल्सो वांटेड टू नो दैट अब हमने ये तो देख लिया है कि वी आर ओव्यूलेटिंग और नॉट, लेकिन एक सबसे इम्पोर्टेंट फैक्टर जो फर्टिलिटी को कंट्रीब्यूट करता है वो है ट्यूब्स. ट्यूबल फैक्टर, ब्लॉक ट्यूब्स एंड नॉट ब्लॉक ट्यूब्स. So how to assess कि tubes blocked हैं या नहीं? What is the imaging modality?
Right, so there are two imaging modalities available for it. The baseline and easily available modality is HSG, that is hysterosalpingography. So it's basically an X-ray of the tubes and your spillage. That मतलब क्या होता है इसका कि अगर आपकी ट्यूब्स खुली हैं तो एक स्पिल दिखता है, उससे असेस किया जाता है कि आपकी ट्यूब्स पेटेंट, दैट इज ओपन है कि नहीं है. सो इट इज हाउएवर अ पेनफुल प्रोसेस. So there are multiple factors you need to consider, and there's a particular time, that is after the 8th day. You must get this HSG done once your cycle has been over for that month. Okay, and also once you get this HSG done, then you should always have mentally in your mind that it can be painful. However, we insist, at least in private clinics, that we give painkillers to the patient because we understand that it will be a painful time for that day for the patient. But still, if there is especially a blockage or problem or intravenous spillage, of the contrast, it can be little torturous for the patient. So HSG is the modality of choice and is baseline available, but there is another investigation, that is sonosalpingography, which also gives lot of
routinely do it. Do you do sonosalpingography if the patient complains of pain? Do you think that is a better one as compared to HSG?
Definitely, sonosalpingography is, I will say, not at all painful in comparison to HSG. And in addition to the tube patency, I also see the endometrium. in
Yes.
sonosalpingography. So, it's said that why do you get a second day baseline scan for the endometrium? Because you can see there is, liquid inside your endometrial cavity, and you can see the endometrial lesions. Same way in sonosalpingography, we use a saline installation, and that's how we see the patency of the tubes and also the endometrial cavity. तो दोनों ही हमारे purpose solve हो जाते हैं, patient को pain भी less होता है. But I know that in India, many centers don't do sonosalpingography that often.
Not many centers do. They are not expertised in this.
Yes.
But viewers को ये पता होना चाहिए कि HSG के साथ अब SSG भी लोग कराने लगे.
Yes.
तो अगर आप थोड़े भी वरीड हैं कि ये पेनफुल हो सकता है, तो आप अपने डॉक्टर से बात करिए कि क्या आप SSG करते हैं.
बिल्कुल बिल्कुल. एंड इफ यू आर वन ऑफ दोज जिसको पेन से थोड़ा इशू है, जो काफी लोग को रहता है, सो देन एसएसजी इज द ऑप्शन फॉर योर चॉइस. सो yeah, you can go ahead with that. So coming back to Dr. Anushri, I want to ask, since we're talking about infertility, fine, 1 year window, everything, but what is this unexplained infertility? So many patients come up to us कि doctor हमें तो कारण नहीं पता. What is this unexplained infertility? Can you just tell something about
that? Very good question, Dr. Soumya. डॉक्टर के पास आने का मतलब है कि हमें पता चल जाएगा कि क्यों नहीं बेबी हो रहा है.
राइट.
लेकिन सारे फैक्टर्स को एक्सक्लूड करने के बाद जब हमने देख लिया कि ओवम भी बन रहे हैं इसका ट्यूब भी ओपन है, इसकी एंडोमेट्रियम भी अच्छी है, इसका माउथ भी ठीक है, हस्बैंड का सीमेन एनालिसिस भी सही है, सारी चीजें नॉर्मल होते हुए भी वो कंसीव नहीं कर पा रही है. Now that is a very big question in a patient's mind कि इतना स्ट्रेस क्यों, मेरे को अभी भी बेबी नहीं हो रहा है. So 20% of total infertility patients can have unexplained infertility. That means there is no known cause as to why this is happening. So in these cases, this diagnosis is generally made when all the recommended testings have failed to reveal any abnormality. And the treatment by definition is then empiric, because it does not address a specific defect or you can say a functional impairment.
Right.
The treatment includes expectant observation with timed intercourse, lifestyle management, clomiphene citrate, IUI, which is intrauterine insemination, and followed by controlled ovarian hyperstimulation, thoda bada word hai, and IVF.
Right. No, but I'm glad that we're talking about unexplained infertility, because at usually this point, the patient or the couple feels, okay, my doctor is not doing the right job and I should change it. So, but no, there is a condition known as unexplained infertility, because your doctor is trying best to help you out in this condition. So stick with it, be patient. This process does take time. So since you talked about IUI, I really want our viewers to know that what is the difference between IUI and IVF? Is it same? Is it different?
There is a similarity. IUI and IVF सुनने में दोनों एक जैसे लगते हैं, शुरू भी आई से होते हैं, ऐसा लगता है दोनों एक जैसे हैं, लेकिन there is a vast difference between both the procedures. IUI is intrauterine insemination. Intrauterine insemination is nothing but what we do, it's an office procedure जिसमें जब बस हम हस्बैंड के शुक्राणु which is sperm को कंडेंस वॉश करके फीमेल की सर्विक्स के थ्रू, बच्चेदानी के मुहाने के थ्रू बस इंजेक्ट कर देते हैं सिरिंज से. सो वी डू नथिंग. पेशेंट ओव्यूलेट कर रही है नेचुरली, या हमने उसे कोई दवाई देके उसके अंडों को बड़ा किया हो. हम अज्यूम कर रहे हैं कि ट्यूब्स उसकी खुली है, हमने एचएसजी करा और ट्यूब्स ओपन है, हमें मिल गई है. तो हम हस्बैंड के स्पर्म को कॉन्सेंट्रेट कर लेते हैं और एक बच्चेदानी के मुहाने से एक सिरिंज से इंसर्ट कर देते हैं. So we are just bypassing that whole passage.
But the sperm and the egg is the same, like of the parent.
Yes, of course. Generally, it is the same until unless the husband doesn't have any sperm. In that case, we can use donor sperm. But in general, it is the husband's sperm. It is the wife's ovum. We don't make a baby. We just insert condensed sperm. That is it. And the goal is basically to increase the chances that more sperms will encounter the egg which is released from the ovary.
Right.
And
especially I think IUI is it recommended when there is a motility issue of the sperm?
Exactly. So it is recommended when a woman has ovulation problems, or maybe there are minor abnormalities in the sperm analysis like concentration, motility in such cases, or maybe unexplained infertility, mild endometriosis. In such cases we tell आप IUI से ट्राई कर लीजिए. लेकिन सक्सेस रेट बहुत अच्छे नहीं होते हैं IUI के. हार्डली बुक्स हैव सेड 30% सक्सेस रेट होगा, क्योंकि हम इतना कुछ कर नहीं रहे हैं, हम सिर्फ बाईपास कर रहे हैं एक कैनाल को. Rather, now let's talk about IVF. So IVF is totally a different approach. It is in vitro fertilization. हम एक फीमेल को, एक वाइफ के ओवरीज को स्टिमुलेट करके उसके एग्स रिट्रीव करते हैं, हस्बैंड के सीमेन में से स्पर्म लेते हैं, दोनों को आउटसाइड मिक्स करते हैं एक पेट्री डिश में, एक बेबी बनाते हैं, एक एम्ब्रियो बनाते हैं, और उसको, जिसे हम भ्रूण कहते हैं हमारी लैंग्वेज में, और उसको अंदर चिपकाते हैं. तो जब हम एक पूरा बेबी अंदर चिपका रहे हैं, तो इट्स डेफिनेटली द होल द गेम चेंजेस. एक तरफ तो हम केवल स्पर्म डाल रहे हैं और एक तरफ हम बेबी चिपका रहे हैं.
So definitely the success rate, right? Sorry, but the success rate with IVF is definitely better than IUI.
Much better.
Because we have a specific location also to implant it. Like,
of course,
we're just not just standing inside. Yeah.
Of course, even the cost, IUI is considerably less effective than IVF, and the couples may require multiple cycles of IUI, and overall expenditure is almost like 1/3 of what IVF has.
Right. So that is okay, but that is also a socioeconomic factor, is also one of the concerns with the Indian population, I feel. But finally, when you have to take multiple cycles, what is better for you, you have to judge accordingly.
Yes, so you definitely have to judge. But there are certain cases जहाँ पे आप IUI attempt भी नहीं कर सकते हैं, आपको directly IVF के लिए जाना होगा. ये समझना बड़ा.
Can you brief? There are certain cases. Can you just tell a few conditions commonly?
बिल्कुल. सबसे important है, दोनों ट्यूब्स ब्लॉक हैं. आपने HSG करी और आपने देखा दोनों ट्यूब्स ब्लॉक्ड हैं. आपके पास कोई चॉइस ही नहीं है, आपको जाना ही IVF के लिए पड़ेगा. आपने हस्बैंड की सीमेन एनालिसिस कराई, एज़ोस्पर्मिया, स्पर्म है ही नहीं या बहुत कम है, डायरेक्टली आपको IVF ही ऑप्ट करना पड़ेगा. IUI आप कर ही नहीं सकते हैं. आप ओव्यूलेट ही नहीं ठीक तरीके से, आपका ओवेरियन रिजर्व बहुत कम है. तो आप स्लो कम ड्रग्स देंगी तो इतना ओवरी स्टिमुलेट नहीं होगा. आपको सुपर ओव्यूलेशन या ओवेरियन हाइपर स्टिमुलेशन करना पड़ेगा. उन केसेस में भी आपको IVF ही करना होगा. सो दीज आर डायरेक्ट कंडीशंस. ग्रेड 4 एंडोमेट्रियोसिस, फ्रोजन पेल्विस है, डायरेक्ट आपको IVF ही ऑप्ट करना होगा.
Also, I wanted to ask, because this is a very common problem encountered, since you are the expert, I wanted to answer if the female is actually okay and everything, all the parameters are fine, ovaries are stimulated, she has eggs, and the sperm is problematic. Okay. And there is a motility issue, or there are less sperms. Is there any medications, like non-surgical ways we can stimulate that as well? Like you just said, we can stimulate the eggs of the female. Can we stimulate the sperm? Like, is that?
So that is a very good question. It depends. अब sperm कम है, क्या क्या कारण है? ऑब्स्ट्रक्टिव है कि बनने में ही प्रॉब्लम है, बनी नहीं रहे हैं तो ड्रग्स अलग होंगी. ऑब्स्ट्रक्शन है तो कुछ और, प्रीमेच्योर इजैकुलेशन प्रॉब्लम है, वो आपको डिस्कस करना पड़ेगा उस मेल से कि प्रॉब्लम कहाँ पे आ रही है. उस अकॉर्डिंग ही आप ट्रीटमेंट देंगे. या तो आप मल्टीविटामिन से उसको सपोर्ट कर सकते हैं, और अगर स्पर्म बन ही नहीं रहे हैं तो आपको हार्मोनल ट्रीटमेंट करना होगा.
Right.
It depends on what actually is the problem. So a proper history is very important. You have to elicit
a proper workup of the male genitalia is also very important.
Very, very important.
So females and males both have equal role in infertility. It's not just a one women show. Right. So very well. I'm loving this discussion. I hope that people who are attending is actually benefiting out of this. So coming to one more question, which I really feel even pregnant patients come to us with that, and even non-pregnant ones come to us with that, is the preconceptional diet. Like, what should I eat to conceive? What should I eat to have a very intelligent?
तो हम pregnant हो जाएं, कुछ तो ऐसा बता दो आप.
So I really think that is there a specific diet you should follow in which it will help you conceive a baby or have a healthy fetus?
So preconceptional care and pre-pregnancy diet, or you can say fertility boosters, different words are being used, but at the end of it, you need to have a healthy weight, you have to exercise, and you have to take care of your diet.
Right.
So when you are ready to start a family, maintaining a pre-pregnancy diet and a lifestyle is the most important thing that you can do. The
Right.
goal is basically to increase your fertility. So first and foremost thing I would like to say is start taking a good preconceptional prenatal vitamin, that is folic
Yeah.
acid. The
Okay.
dose is 500 microgram, and this is basically recommended dose to prevent neural tube defects. So 3 months prior to conception, when you start planning, or even when you're not able to conceive, folic acid you have to start. Apart from that, get your vitamin D levels also checked. If they
Right.
are low, like that is less than 30 nanogram per ml, and start taking 2000 to 4000 international unit of vitamin D3 until
That
the level.
is that is very interesting because Indian females usually have a low vitamin D.
Yeah,
Is
because the
it
sun
isn't it
exposure
true?
is less,
Yes.
and they need to take vitamin D.
So
Uh,
folic acid, vitamin D. Two
yes,
things.
exactly.
Anything else?
Third, smoking. A very important
Uh,
question. It affects all stages of reproduction, not only male but also female. So,
okay.
every one cigarette per day, there is
Hmm.
chances of 1% risk of abortion.
I want you to repeat this because there's so many new age moms who want to
Yeah,
hear this. Please repeat it, Dr.
exactly.
Anushri.
So, smoking, and I also wanted to emphasize passive smoking also affects. So, it's not
Oh,
only active smoking, but passive smoking also decreases the fertility potential. And it
okay.
affects both male and female. It affects male because it increases the oxidative stress, it
Right.
decreases the sperm count, the
Hmm.
motility.
Hmm.
So, definitely it is affecting the male. And also, it is affecting the female. Like, for example, if you have one cigarette per day, then there
Hmm.
are chances of 1% risk of abortion if you conceive.
Okay. Okay.
So this is very important. Then
Right.
a lot of
So,
people also
so
question
for
me
for
about
example, this is a common question. A young girl comes up to me, a young wife comes up to me,
yeah,
and she says that, all right, I've been smoking throughout
yeah,
my college, and now I'm married, and now I think I should plan my babies. So, should I stop smoking, or when I get pregnant, I can stop smoking?
of
So, the
course.
answer to it
Abhi
will be
stop kar do.
because it's not, you don't have to wait till the last moment
Yes,
and fall short of fall there'll be a long list of problems, medical problems associated, so it's better you stop now and try.
bilkul.
Always better, right? Any other foods which you think
Of course.
enhance?
Now, also talk about coffee. So, there are a lot of people who take a lot of coffee. So,
Hmm.
caffeine intake is also related to decreased fertility potential. They say that maybe, 200 to 250 milligram of coffee should be a per day basis.
Okay.
So, I was just reading and going through. So, it says a tall grande of Starbucks brewed coffee
Yeah.
is almost like 230 grams of coffee. So, it's 230 milligrams. So, you need to have just one or two coffee.
In a
Limit the
day.
intake of
In a
coffee.
day.
Yes, in a day.
And once you're pregnant,
Then also you have to reduce it to one coffee. One
right,
coffee is
because
okay.
that also affects your fetus. So
Of course.
coffee. Also, I want you to emphasize on alcohol because I think young moms would want to hear about that too.
Now this is a
Alcohol.
very there is a mixed question actually. Research based studies say there are mixed reviews if alcohol will affect or will not affect.
Hmm.
But books say that you have to stop drinking. You have to reduce the alcohol intake totally 3 months before you start planning or having a baby.
Correct. Correct. Because the children can have inborn errors.
Yes,
If
exactly.
you intake alcohol during conceiving, also, so
That's
you
called
must stop.
alcoholic syndrome. That's what you mean?
Yes.
Yes,
Yes.
of
It's not
course.
that prevalent in India till now, but please let's not go there.
I also wanted to focus on something about diet, about what kind of diet a patient
Yeah.
should take. So we need to opt on good fats in your diet, like reduce the fried fat. Try
Right.
taking good fats like olive oil, avocados, nuts, and greens,
Right.
seeds. Apart from that, choose low glycemic carbohydrates like legumes, fresh fruits, oatmeal, and quinoa in your diet, and not
Mhm.
starchy food like
Right.
rice, bread, and pasta, which we are very fond of. So we can
Right.
reduce that. Also,
Right.
in polycystic ovarian disease, where there is anovulatory disorder, we avoid dairy products. So that
Hmm.
is also you need to follow कि हम dairy products थोड़े से कम कर दें.
Hmm.
and eat more vegetarian sources of iron like spinach, beans, legumes. So this is important in terms of fertility diet.
So definitely when patients do ask that preconceptionally we should consider some changes, lifestyle changes, these are some lifestyle changes you must consider. And it's very crucial that, when you improve your lifestyle from here on, your 9 months go easy on you. So
Totally. Moderate form of exercise is also important,
Yes.
not very strenuous.
Yes, and that is preconceptionally as well as during your gestation, as well as when you are pregnant, you
When
must
you are-
have some form of cardio in
Yes.
your lifestyle. All right, so I think any other question you think we
Soumya,
should?
I want to know, you have asked me a question, pregnancy से पहले क्या
हाँ,
हमें डाइट करनी चाहिए, क्या क्या
right,
करना चाहिए? अब हो गए
right.
हैं प्रेग्नेंट, तो
Okay.
सबसे बड़ा क्वेश्चन आता है, कितनी अल्ट्रासाउंड कराएंगे, इतनी रेडिएशन मिलेगी, हम करा लें अल्ट्रासाउंड, और अभी क्यों कराना है, एक ही करा लेते हैं. So what is your take on that? What is the role of radiation in pregnancy?
Thank you for asking me that question, because this is a question I answer to every second patient I do a scan for, because they are always very worried कि कितना मैं baby को अपने expose कर रही हूँ radiation, it's so harmful, are you hurting my baby with that probe? No, we are not doing any of those things, because ultrasound is proven to be radiation free. That means it does not cause any radiation, because ultrasound, USG, sonography जो आप कराते हैं वो sound waves की technology में बनी है. For example, you listen to the FM or you listen to some good music, those are sound waves. So the same technology has been inbuilt in with crystallization in sonography. So when you get a sonography, the sound wave beams go, hit the organ, come back, and we interpret an image. So therefore no radiation. It's not like an X-ray or a CT scan जिसमें radiation होता है और expose होता है baby, उससे उसको harm हो सकता है. No, sonography is nothing of those sorts. Also, this is very commonly asked कि अभी तो मैंने सोनोग्राफी कराई थी 12 वीक्स पे, फिर आपने 19 वीक्स पे सोनोग्राफी एडवाइस कर दी, फिर इतनी बार कराएंगे तो बेबी को तो बहुत नुकसान हो जाएगा.
स्वामी, सबसे पहला अल्ट्रासाउंड वैसे कब कराना चाहिए?
So the most important also I feel ultrasound, and the first ultrasound should be done between 6 to 8 weeks. Okay, that is known as the dating scan or an early obstetric scan. So that provides you n number of information. First and foremost, pregnancy आपकी बच्चेदानी, that is uterus में ही है कि नहीं, most crucial. Yes, that also for people who are listening to this webinar, also for those who don't want to continue their pregnancy and they have chosen not to continue the pregnancy, for them also this ultrasound is very important before you take any medicines, because the scenario totally changes when the pregnancy is within the uterus, that is the normal pregnancy side, or it's outside, that is the ectopic pregnancy. So first and foremost it rules out that there's no ectopic pregnancy. और sometimes ये भी केस होता है कि एक यूट्रस में प्रेगनेंसी होती है, एक बाहर भी होती है, ठीक है, जिसको हम हेट्रोजेनस प्रेगनेंसी बोलते हैं. तो वो कंडीशन नहीं है, सिर्फ एक ही प्रेगनेंसी बच्चेदानी के अंदर, दैट इज विद इन योर यूट्रस है, नॉर्मल साइड. फर्स्ट. सेकेंड, इज इट ट्विंस, सिंगल, ट्रिपलेट्स, क्वाड्रुप्लेट्स, दैट ऑल्सो यू कैन rule out. All right, especially when you have opted for an IVF, you want to know that answer. Yes, and if if there are multiple fetuses, multiple pregnancies हैं आपकी यूट्रस के अंदर, तो क्या वो सभी वायबल है कि नहीं है? वायबल का मतलब हार्ट बीट है, कार्डियक एक्टिविटी है कि नहीं है. थर्ड मोस्ट इम्पॉर्टेंट, उसका सराउंडिंग रिएक्शन, कोरियोनिसिटी सही है कि नहीं, एंड आपकी प्रेगनेंसी जो आप अपनी LMP बता रहे, दैट इज लास्ट मेंस्ट्रुअल पीरियड से करस्पॉन्ड कर रही है कि नहीं. बिकॉज जो फर्स्ट स्कैन है उसी पे हम डेट करते हैं कि आपकी आगे की स्कैनिंग कैसे चलेगी, कि हम बेबी की ग्रोथ को सिर्फ एक स्कैन से असेस नहीं करते, हम इंटायर हर एक स्कैन से उसको असेस करते हैं. जो वीकली हमारे मंथली स्कैनिंग चलती है उससे ग्रोथ पूरी मॉनिटर होती है. सो दैट फर्स्ट स्कैन इज वेरी वेरी क्रूशियल. दैट्स व्हाई यू डेट द प्रेगनेंसी एंड यू जज द साइड एंड यू जज द कोरियोनिसिटी. सो दैट इज द स्कैन व्हेन यू शुड गेट इट डन एट 6 to 8 weeks. Now this next most important scan, आप प्रेग्नेंट हो गए हैं, आपने रेटिंग स्कैन करा लिया है, so now the new guidelines say कि हमको 12 वीक्स पे, that is 11 वीक्स से 13 वीक्स 6 डेज के बीच में एवरेज 12 वीक्स में हमको एक NT-NB स्कैन कराना चाहिए। NT-NB स्कैन भी बहुत क्रूशियल स्कैन है, बहुत इंपॉर्टेंट स्कैन है, क्योंकि हम इस पे 85% तक क्रोमोसोमल अनोमलीज को रूल आउट कर देते हैं। एंड इफ यू कंबाइन इट विद द ब्लड टेस्ट, दैट इज द डबल मार्कर्स, यू नो, द कंबाइंड स्क्रीनिंग, देन आप क्रोमोसोमल अनोमलीज को 95% तक रूल आउट कर सकते हैं। तो वी डोंट हैव टू वेट टिल द 19 वीक टू सी कि बेबी में कंजेनाइटल प्रॉब्लम्स हैं, स्ट्रक्चरली कोई प्रॉब्लम है कि नहीं। स्पेशली ये इंपॉर्टेंट आपके लिए और हो जाता है जब आपकी प्रीवियस प्रेगनेंसीज में आपको बहुत सारे मिसकैरेजेस हुए, या यू हैव नॉट एनालाइज्ड in infertility like IVF cases की preconception या आपने chromosomal analysis नहीं किया, you're unsure where you're taking the donor eggs or the sperm from, that can also be a very, very important scan for you, because you rule out many things in that. Third scan, coming to target scan, जो सालों साल से ये हो रहा है, now people have knowledge about target scan. I think that is done at 18 weeks to 22 weeks now. The new guidelines have changed since the MTP Act has been revised. So
पेशेंट को हमेशा सिखाना पड़ेगा कि आप अपनी प्रेगनेंसी को वीक से रिलेट करें और मंथ्स में डिस्कशन ना करें।
yes, because they don't understand, I feel कि कितने
हमसे बात
वीकर
करते हैं, 2 महीने आए हैं, 3 महीने चढ़े हैं, 4 महीने, they have to be told कि इतने वीक्स की प्रेगनेंसी से बात करेंगे आप लोग।
And you will always find your weeks in your reports, always, you must. आपकी रिपोर्ट में हमेशा आपको बेबी के वीक्स मिलेंगे कि इतने वीकर फीटस आपका है और ये कंडीशन में है। This is how a good report should be. All right. So target scan is also very important, because then they are that's a very detailed scan. Not only the kidneys and the fingers and the eyes or the nose, but we also see the brain and the heart, you know, all the aspects. So that is also
during that time.
We do Doppler analysis for preeclampsia screening both at 12 weeks as well as 19 weeks. Okay. So if a patient is a patient of, you know, high blood pressure, that is preeclampsia, or you know, undiagnosed case of preeclampsia, then that screening is really important and essential for you. So at Qura Diagnostics, we do baseline screening for all, no matter what. So that really helps the gynecologist to deal with that condition, especially in precious pregnancies. You know, when a couple is going through infertility, they want all parameters to be sorted and normal. So that's why baseline screening for all these things are very essential. By this time, the patient is very confused. Okay, मैं तो इतनी बार already scan करा लिया baby का, अब तो मुझे जरूरत ही नहीं है. No, but that's not the case, because when you hit your third trimester, things change drastically in a pregnancy, and that's why a color Doppler is suggested at between 28 weeks to 32 weeks, and one in the late third trimester, that is at 36 weeks onwards, depending on the position or the diseases the fetus is going through.
So in total कितने अल्ट्रासाउंड्स हुए हमारे? एक बेसलाइन स्कैन 6 to 8 वीक, एक एंटी स्कैन 11 to 13 वीक्स, एक 18 to 20 वीक लेवल 2, एक डॉपलर 28 to 32 वीक, और एक फाइनल एक स्कैन 36 वीक के बाद.
Yes, and there can be more if you are suffering through preeclampsia or gestational diabetes or many other conditions. कुछ ऐसा फीटल में स्ट्रक्चरल अनोमली है जिसमें आप कंटिन्यू कर सकते हो अपनी प्रेगनेंसी, फीटस को इतना हार्म नहीं है, तो हर एक की फॉलो अप प्रोटोकॉल अलग होती है. बट आप अगर अपने बेबी को 50 टाइम्स तक भी सोनोग्राफी करा लोगे तो बेबी को कोई रेडिएशन नहीं मिलेगा. That is a very important point for you to take home from here. So it is essential. ये टेक्नोलॉजी बनी इसलिए है कि हम फीटस को देख पाए और डॉक्टर और आपकी मदद कर पाए. So yeah, 5 important scans, but there can be more and they are safe. So thank you so much for being a part of our webinar series, and this was such an informative lecture and such an interactive talk, and I feel मेरे भी कितने सारे doubts clear हो गए, you know, when we talk. Yeah, because generally belonging to different super specialties, you generally don't interact in such a way because we are all busy with our work lives. But we also learn so many things every day when we meet like this, and I love the fact that we are able to simplify so many doubts of all our viewers. So thank you so much, everyone, for coming here. And
thank you so much.
Yes, thank you, Anushi. I think we'll do this again very soon.
Let's do it again. Okay, see
you. Thank you. Bye-bye. Be safe, be healthy.